The Honorable Lourdes A. Leon Guerrero, Governor of Guam, Nagahagan Guahan, and Linda and Pico DeNorsi, Director of Public Health and Social Services, as well as Rear Admiral John Minoni, Commander of Joint Region Marianas. And now to Governor Leon Guerrero for her opening remarks.
Thank you, Janella. How today? By now, we've all heard of the term flattening the curve. When we say flattening the curve doesn't refer to the true number of COVID-19 cases. Rather, it refers to the projected number of people who will contract the virus. When we look at the graph, the curve is actually two curves that demonstrate the spread of the virus with and without mitigation efforts like social distancing. In addition to those two curves, there's another line, usually dotted, that represents the peak capacity of our healthcare system or the hospitalization rate. Flattening the curve isn't about reducing the number of infected cases, at least not entirely. The ultimate goal is to protect our hospitals and reduce the number of cases that require acute care. While we thankfully only have 2 patients currently hospitalized for COVID-19, we cannot forget that at the beginning of this month we had 20, and that was already placing a strain on the hospital. To date, we have tested 1,495 individual samples through public health, DLS, and GMH, not including samples tested through Naval Hospital and at the National Guard. This weekend, we conducted a testing pilot program for residents of Astumbo and Dedido, as well as the program for first responders at the Guam National Guard. And I am happy to announce that we will be expanding the pilot program this week to include all residents. From April 28 to May 1st, people with COVID-19 symptoms can be tested. We encourage those with symptoms who live in multi-generational households to stop by because they are among the most vulnerable. Further information will be provided at a later date. Expanded testing is happening. We anticipate more test kits this week, and we will continue to implement testing programs that target our most vulnerable population. As I and members of my physician advisory group have said before, our current measures have prevented the worst case scenario from coming to fruition. The models were wrong because we have done all we could to make them wrong. Our numbers today, what we are seeing now, would not have been possible without everyone doing their part. And I do thank you for your patience and your tolerance in the most recently implemented measure, which is the roadblock. And because we are seeing better numbers, I have then directed that the roadblocks will no longer be in effect starting tomorrow, Tuesday. There will be the roadblock tonight, but as of tomorrow, Tuesday, and moving forward, we will not have the roadblock. But we are going to, again, be monitoring very closely our incidences of COVID cases to, again, be assured that that decision is adequate and also appropriate for the circumstances we are in today. I'd like to now ask Admiral Minoni to please present his briefing.
Good afternoon, everyone. Before I get to an update concerning our efforts to support USS Theodore Roosevelt, I have a couple of announcements. First, the Navy Marine Corps Public Health Center and the CDC conducted a COVID-19 public health outbreak investigation last week with volunteers from the crew of Theodore Roosevelt. The results from this investigation will help us to understand more about the virus and help us to inform COVID-19 surveillance and mitigation strategies for the fleet. Second, the Anderson Air Force Base 554th Red Horse Squadron completed construction of the Expeditionary Medical Support System last week on the grounds of U.S. Naval Hospital ground. The EMED system is operational as of April 20th and is ready to receive patients should the need arise. Construction by CTF-75 Seabees continues on the larger Expeditionary Medical Facility project at South Benagayan. We expect that this field hospital to be up and running in the coming days to support TR, and if needed, we will be postured to help support the government of Guam in the fight against COVID-19 if requested. Finally, I would like to provide a few words from TR's commanding officer, Captain Carlos Sardello. Quote, as our understanding of the COVID-19 virus continues to evolve, we have adapted our timeline to ensure the health and welfare of our crew, the swift recovery of the ship, and the return to our mission. Theodore Roosevelt sailors are spending the required off-shift time to ensure that we get underway with a healthy crew. We greatly appreciate the continued support of the government of Guam for the lodging off base, which provides for quarantine accommodations that are in accordance with CDC standards. I would like to personally extend my thank you to the people of Guam for their support in this time of crisis and for their stalwart support and cooperation that I've personally witnessed and experienced over my 30 years in the Navy. Thank you, unquote. Concerning the USS Theodore Roosevelt, the Navy announced that 100% of the TR crew has been tested for COVID-19, with 833 total positive tests, 4,105 negative tests, with a small number of results still pending. Of the total cases, 112 sailors have recovered. Today, there are currently 7 TR sailors at Naval Hospital Guam, but only 2 of them are there for treatment of COVID-19 symptoms, with none of these sailors in the ICU. The TR team has done a tremendous job cleaning the ship in preparation for the crew's return aboard. I'm proud to say that we will begin that process to rotate sailors back to the ship this week. This is the next big milestone in our mission to get the ship safely back out to sea and in defense of our nation. Thank you for your continued support.
I'd like to ask Director DeNorsi now to present her update.
Yes, as of yesterday, we added on an additional person that has a COVID positive. So today we're reporting that our grand total is 142 of our positive COVID cases. Of that 142, 118 are local, 14 are U.S. Naval Hospital. And again, those tests are done by the Department of Defense's reference lab in San Diego. 6 cases are confirmed by our diagnostic laboratory services, and 4 are probable cases, thus resulting in 142. Just to give a little bit update of the 142, again, 18 are travel related, 124 have no travel history, and of that 124, it is broken down as follows. House contacts, 34. Community contacts, 13. Healthcare contacts, 19. And that's broken down in terms of as a patient, 5, and as a healthcare worker, 14. And 58 have no reported contacts. Giving you an update in regards to our quarantine sites, we currently have 188 at the Pacific Star Hotel. And of those that in the past that we started since April 2nd, all the way to the current April 27th, we now have 421 individuals that have cleared through our quarantine facility. Currently, we just have 1 individual in our isolation area, in the Government of Guam Isolation Facility. And to visit our website at www.dphss.guam.gov will give you a lot of information as far as all the updates that you can find in our data and our dashboard. And I would also like to give an update as far as our outreach activity, as the governor had indicated. We are expanding our ability to test. And I'm happy to report, Governor just going to find out today that our test kits actually came today. So we're very happy to report that. And we want to emphasize that I also have a backup as far as other test kits that we're going to have. If they want more detail, I'll be more than happy to share that. In regards to our expanding of our COVID-19 testing capacity, we're looking at both the drive-through and the walk-in. And this Tuesday, April 28th, we have at the Astumbo Gym in Dedido from 3 to 6 o'clock p.m. Testing will be limited to the residents of Dedido and Higo. However, on Wednesday, the next day, April 29th, again, same place at the Astumbo Gym in Dedido from 3 o'clock to 6 p.m. The testing will then be open to all residents island-wide. On April 30th, we are happy to report that we will have the testing from 3 to 6 at the Manilao Senior Center next to right where the Santa Teresita church is. And we will open that to all central residents of Adenia Heights, Asan, Maina, Barragata, Chalampago, Ordet, Agатnia, Manila, Mongmong Toto Maiti, Sinahanya, Tamuni, and Tumon. On Friday, May 1st, we will have it at Agate Senior Center from 1 to 4 p.m. And that will be open to all our southern residents of Agate, Inarahan, or Inalahan, Marizo, Pidi, Santa Rita, Calafoco, Umatic, and Jonia. We also want to emphasize that residents that are coming to any of these outreaches throughout this week, that they really come in for those specifically who have COVID-19 symptoms, or they have multi-generational facilities, families in their home, as the governor had indicated, grandma, grandpa, and so forth. We also would like to emphasize that we continue to also expand our ability to test through all our clinics, public and private. And for those of you, you can call your healthcare provider and then get tested. And you can also, those of you who have no health insurance or no provider, you can call any of our public health centers and also our public health triage phone hotline. And again, that number to call is 480-7859 or 480-676-023 or 480-7883 or 687-6170. That's dedicated to the ADA people. Thank you, Governor.
Okay. Thank you, Linda. Open for questions now?
Yes, just a reminder again, you get one question and one follow-up. We'll begin with Mariana's Business Journal. Wayne Chargaloff, are you there? And if not, Maureen Maritita.
Hello.
Yes, Maureen.
Is Wayne not there? If
No,
not,
see Wayne. We can go back to you if you're not ready.
no. Well, yes, I'd prefer that you will, but I will get a question ready.
Okay, do you want it to go back to you?
Yes, please.
Okay. Next is the point, Nick Delgado.
Hi, Governor.
Hi, Nick.
So the question that I had is a follow-up to your Facebook Live post from last week, Friday, to the businessmen. What is your comment to the people who felt that your "glad you're alive to hear me" message was hurtful or had a hint of sarcasm? Did you mean you are considering financial relief out of Guam coffers for those who haven't had paychecks for 6 weeks now and don't make $10,000 a year?
What was your question again?
What is your comment to the people who felt that?
Several issues there, Nick. So which one?
Okay, so what is your comment to the people who felt that your "glad you're alive to hear me" message was hurtful or had a hint of sarcasm?
There was no intention to be hurtful, and there was no intention to be sarcastic. Just that reality exists. Okay, thank you for that, Governor. The second question, it could be either coming from you, Governor, or from Linda, but I was asked to share a letter sent to me anonymously by social workers at Child Protective Services. It's rather lengthy. So for the sake of time, I sent the full letter over to your staff. To summarize, they write, "We work for the most vulnerable, the children who are abused and neglected. Are we afraid? Yes, because the reality is we enter territory with uncertainty. Yet we do not think about the hazardous pay or night differential that we do not receive. We deal with the malfunctions of internal management that does not provide support. We encounter children who may be sick or continue to struggle with placement without solutions. We have little to no PPEs, 2 boxes of masks, and a handful of gowns, no other forms of sanitizers. We are tapped to assist in COVID-19 efforts and heard that we were deemed non-essential by our superiors. We are not looking for sympathy, we are looking for solutions and dignity for our profession." So what is your response to this complaint, and are government workers like them really being put at risk without proper protection?
No, in regards to our whole department, everyone is essential. I made that very, very clear. Everybody in the beginning, some people had stayed home, others had come to work. I made it very clear that everybody was essential. And so In regards to our PPE, we do have arrivals of them, and they need to go through the process, which is to go through the logistics personnel, and they will bring in their order and we will fill it in and have it sent to them. I believe that everyone in the department is very critical, and for that reason, I made it very clear that I wanted all the social workers to work. A lot of them that were placed in the Walsa area were having to utilize them in certain areas within our department, and because we still were at a severe shortage of social workers, and some of them emphasized that they still need to be in their proper facilities, we had some help by the other agencies to fill in the gap. For example, DOE social workers that came into place. And it was not just the social workers, we also had other needs for our other units within the department. And so we also got help from the AG's office to do that. So everybody was essential, and I'm glad that you brought it up because I did emphasize that people should report to work. Now it's up to the supervisors to make that decision as far as where they're going to work. I leave that to my supervisors to make those decisions. If there are any complaints, they're welcome to come to me, and there have been a complaint or two, and I address those complaints so that there's fairness all across the board. Thank you.
Thank you, Nick. Apologies, Wayne was there, we found him. So we'll go back to Wayne from Mariana's Business Journal. Maureen, we found Wayne, so we'll go back to Wayne. Go ahead, Wayne.
Hello, Governor.
Hi, Wayne.
Hi. Regarding the Federal Pandemic Unemployment Compensation Program, the FPUC, people who are still working but whose income exceeds the $345 per week cap will not be eligible for the $600 weekly payments, even if they've had their hours reduced. So for a lot of people, that's a fairly large amount of money to lose out on. Has the local government at least explored any ways to address situations where people don't qualify for the program but are still in financial distress due to reduction in pay and hours?
So, Wayne, people whose hours are reduced are eligible. They would just have to work with their employer, because what's going on is we are working our internet process, and we will have a portal up where the employers will have to register along with a listing of their employees. And the listing is to include those that have been unemployed or laid off as a result of the COVID virus and whose hours are also reduced. They are eligible.
And may I add
So-
to?
Go on.
Yeah, I just
so
want to.
go on. Sorry about that.
Yes, I just want to also emphasize that the department also has a lot of public assistance programs and welfare programs. And so we have been actively involved in getting applications in, and also looking at new applications coming in from all the different programs like the cash assistance benefits, the SNAP, the Supplemental Nutrition Assistance Program, MIP, the Child Care Development Funds, and also Medicaid. And so our numbers continue to rise, and we're very much aware that these are issues that are continually coming through our doors for applicants and continuing, and also new applicants.
Okay, good, because the information I had read said that anyone who exceeds that $345 cap will not qualify. So is this part of the agreement Guam agreed to for the PUA with the Department of Labor?
Okay, so the 345, I believe, Wayne, is for those people whose state have insurance, unemployment insurance. They're basing the 345 as that's their max, I believe. We don't have unemployment insurance here, so you have to appreciate the fact that we are creating a very new unemployment benefit program. And so we are working through all of those information, but I do know that people who, like I said, are unemployed because of the COVID, and that their hours are decreased or reduced as a result, will get the pandemic unemployment benefit program. They just need to be registered through their employer. And it's not 345, it's actually 945 for 13 weeks, and then 345 for the remaining 26 weeks.
Thank you, Wayne. KUAM, Nestor LaContra.
Thank you. Good afternoon, Governor. Good afternoon, Admiral. Good afternoon, Linda. First question is for the Governor. Do you anticipate any partial reopenings this week, and when will you announce more about your recovery plan? And will you extend the executive order which expires tomorrow?
Yes. So I am going to be rolling out a recovery plan. Sorry. It's at the stage right now where all the various panel members that are representative of the community have submitted their input and their ideas, and we've been really getting a lot of good information from the community, Nestor, in terms of maybe standard operating procedures to be guided once we start lifting these measures. And as a result of that, we will be sending out as guidance through public health. So Thursday, we will be rolling it out, and based on what the numbers are that will be coming in as a result of our expanded testing, based on those numbers, we'll be able to then start looking at lifting measures, some of those measures. Of course, you heard me earlier, we already lifted the roadblock.
Okay, so you're extending it how much longer?
Oh, and extending, I'll be announcing an extension of our public health emergency. It expires May 5th, and we are going to extend it for 30 more days. Two major reasons. One, of course, is we want to continue monitoring and being able to have the authority to initiate those measures and to continue sustaining those measures for as long as we feel is needed, again, driven by medical and clinical data. And also our federal programs that have been provided through the CARES Act and the other two packages of financial aid is only able to be effected as long as the public health emergency continues.
Okay. Can I ask Admiral Minoni? Admiral, as you know, we're waiting a final decision from the Secretary of Defense with regard to Captain Crozier. I know you probably can't comment on that specifically, but how long have you known him? You're both helicopter drivers, and how would you characterize his leadership?
So Nestor, the only thing I'm going to answer is I've known him since TR came to Guam. The rest of that is not my role, and it would be completely inappropriate for me to comment on it. That's my answer for you.
Thank you, Nestor. Pacific Island Time, Johanna.
Half a day, everyone.
Good day, Joanna.
Hi. So my question is for the governor. So Senator Regine Bisco-Lee, she wrote to you to propose that you set aside 10% of the CARES Act funds to give directly to the unemployed. So what do you think about Regine Bisco-Lee's suggestion?
I think her suggestion is right on point, and she and I have actually been working very closely. I did respond to her and informed her that I will be, of course, providing any kind of help to our individuals who need help, our businesses that need help. I just want to make sure that when we do that, that we're not really violating any kind of conditions or requirements as to the use of those federal funds. Because if you take a federal fund and use it to pay for another federal fund, one of those federal funds will be impacted. So I want to make sure that we don't do that. And I did write her and tell her I'm looking at every possibility, whether locally or federally, that we can use to help our individuals out there with the assistance that they need. to try to be as normal in their lives as possible. So I thanked her for her ideas, and I said I look forward to working with her.
Okay, thank you. So my next question is about Tumon. So Tumon now is like the quarantine capital of Guam. Now, what are the plans to clean it up?
The plans to clean it up are plans that would be used to using the CDC guidelines of cleaning it up. Once our sailors start being, I guess, redeployed back to the ship, then I think there's an agreement with the military to for a GHRA, of course, to prepare those rooms for future other clients and customers. And so they'll be following the CDC guidelines, GHRA, and the hotels will be following CDC guidelines in cleaning up those rooms.
Thank you, Johanna. Guam Daily Post, John O'Connor.
Hello, everyone.
Hi,
Can
John.
you hear me? Hello, Governor. Thank you. So this is a question perhaps more for Linda. The headline over the weekend from the World Health Organization stated that there is no evidence recovered COVID-19 patients cannot be reinfected. So can you guys talk about how public health is monitoring or following up with residents who have of recovered residents to see where they're at, what their status is, and if they're exhibiting any symptoms, follow-up symptoms?
Yes, we'll continue to do our surveillance and contact follow-up. If at any time, we've already addressed all those areas that have positive COVID patients. And we already assessed the household and also the close contacts. Now, later on, as we journey through these pockets of infection, we identify anyone that also has symptoms. That's why we're doing this expansion of our testing capabilities for those with mild symptoms. As you know, in the past, we told them to stay home, and we were focusing our energies on all those high-risk priority groups, such as those individuals that were at the hospital that had COVID symptoms, or the healthcare workers, or those with chronic diseases that have COVID symptoms. At any time during this whole process, when we identify positive cases, we'll continue the household contact. We'll continue those that are in close contact. And later on, eventually, if there are asymptomatic symptoms that do occur, we will look into that and we will test them. And we've done that also previously. And those types of tests that were not on the top of priority list, we still send them to DLS. So we will continue to do the contact and the tracing and follow-up. We will continue to enhance our efforts in isolation and quarantine as we journey through. We're not going to let this thing go. No matter what the governor decides in terms of recovery, our efforts will continue to maintain a permanent team that will be in place within our department. And again, to continue as we journey through the whole COVID response. It's not going to end. It's going to continue. We're going to make it part of our department. And yes, as we journey through and we find all these mild cases and multi-generational areas and homes that have all these different people that are in there, we'll continue to conduct testing for them.
Thank you, Linda. So the second question is in anticipation of any future announcements we have regarding recovery. But the criteria from the White House regarding phase comebacks includes things like robust testing program in place for at-risk healthcare workers and including emergency antibody testing. We haven't heard too much about antibody testing. And the second part to this question, if you can indulge me here, is where are we in terms of getting that 258 testing capacity that we want in order to consider reopening the government again?
Yeah, as far as the antibodies, that's still in a very primitive phase right now. They're still assessing that. There's nothing definite because sometimes the antibodies can be produced, but then is it really going to be antibodies that were created of the past? Some people could have that immunity at IgM and IgG. Right now, we're not certain yet. The studies are still there. It's still very primitive at this point in time. In terms of serology, we're not doing serology at this time. We're not doing serology because, again, that's only limited to IgM, IgG, and that could be developed from other COVID testing that could have been done previously to this COVID-19. As you know, there's also MERS and also SARS that is also part of this coronavirus. And so where are we now in terms of the testing? Well, I'm happy to report that today we got the arrivement of 400 gene experts. So we're going to launch our other machine within the department. And we also have 696 more tests added that just arrived today. In fact, we're sharing some with GMH. And right now our ABI 7500, we have 317. So altogether we have about 1,413. However, we're expecting another shipment from the World Health Organization that's expected anytime as I speak, hopefully this week. So we're looking at about 6,100 altogether. And again, we've got that full support. On top of that, we already launched a purchase order with DLS that will give us the capacity also to do a lot of testing that will also be helping us going off island. And so as we journey through these expanded testing that we're going to launch this week, I already communicated with Cynthia and Henson from DLS, and she's giving us the full support should we need to have more of anything to be done other than what we have right now. So that capacity, along with Guam Regional Medical City, they also have a gene expert machine, and they already are getting all their supplies. On top of that, of course, we've requested for the community health center to also participate and getting that support through their grant. They just got a new funding coming in, and we requested for more supplies to be ordered through that grant. And again, we have the gene expert, we have the ABI 7500, we have the Abbott test now in our lab. And of course, in military, the National Guard also has their BioFire machine, and they're also utilizing it to test. Eventually, we're going to move forward as we journey through all the pockets of infection in these remote areas. The next step is to look at our fire department, our first responders, fire department, police department, and also GMH workers, healthcare workers at GMH, and also our community centers, and eventually the whole island health workers. And from there, I think we have a very good perspective of more we test, the more we're going to have a very good data as what the governor wants, so that we can move forward in our plan to say, yes, we're eliminating the COVID ID, and yes, we're going to continue our enhancement in terms of isolation and quarantine. And yes, we're going to be comfortable enough with this data so that we can allow the governor and her recovery committee and team to move forward in lifting it little by little.
So just to clarify, there are 4 criteria that need to be met before we can even trigger going from one phase to the other, and before we can even trigger measures that are going to be lifted, restrictions that are going to be lifted. So you're right, John, one of them is a robust testing capacity. And those are good. Those triggers and that advice to me is going to be driven by the medical and clinical data. So if any one of those criteria is not met, the medical advice would be not to lift those restrictions until we meet them. And as you heard from Linda's very detailed explanation, we are getting the capacity, and I think we are going to be needing the 152 per day per 100,000.
Thank you, John. Next is PNC, Kevin Kerrigan.
Good day, everyone. I wanted to ask a question of Admiral Manoni.
Hi, Kevin.
Hi. You indicated that there are now only 2 sailors hospitalized at Naval Hospital with COVID. And with all the hospital beds that are going up at Naval Hospital grounds and over at NCS in South Bend, that's raised some speculation that the Navy plans for Guam to become a hub for COVID-19 treatment of sailors for other naval ships in the Western Pacific, perhaps the Ronald Reagan. There was speculation over the weekend. So my question is, are there any plans to bring more ships to Guam and offload other COVID-19 sailors for treatment here on Guam?
So Kevin, that's a great question. I finally understand the rumors that have been bouncing around on social media. No, there are no plans to bring any ships to Guam to do COVID-19 response. I confirmed that this morning with the fleet commander. The reason that we're putting up the EMF, Expeditionary Medical Facility at South Finnegan, and that we put up the EMED system at Naval Hospital is twofold. The primary reason was to support Theodore Roosevelt, which I'm sure everybody understands, 5,000 potential patients showing up on March 27th is a significant event for any medical community. And if we try to utilize Guam's, the local medical facilities, and it went badly, we would overwhelm the island's capacity. The second reason, once TR goes back to sea, there will be some small subset of personnel that have not cleared testing protocol that will remain. They will need to be continued to evaluated and treated, whether it's at Naval Hospital or on base, Naval Base Guam. But also, we're all looking at the same models that the governor's looking at with respect to the potential curves that could happen out here. So we need to be best postured to support Guam and the CNMI should there be a significant spike in cases and there is a request for dispense support of civilian authorities. So that's the reason for the EMF going up, which is up at South Finnegan, the EMED system at Naval Hospital Guam, and then the 3rd Medical Battalion, small ICU capability down on Naval Base Guam.
Thank you, Admiral. My second question is for the governor. Governor, we understand you now have the bulk of that targeted federal aid, $117 million in federal funds, plus another 12 million, I understand. Some senators, as you well know, have proposed using at least a portion of that money to stand up quickly some unemployment relief programs to provide paychecks for many that have gone without pay for weeks. What are your plans for that money now?
So we've been given the guidance, Kevin, and the advice from I think the IRS or the Treasury on what are the allowable situations and allowable events that would then be able to be used with these funds that you just mentioned. And I want to make sure that we are following those allowable advice. Otherwise, if we don't, then that benefit could be removed and taken away. The federal government, as you know, is very also focused on accountability and transparency, and that's why they give us the guidance, so we can have information and we can have advice of how best and where can we use these monies. Locally, if I can develop programs locally that would allow these monies to be used as a funding source, of course I will do this. These are monies that are given by the federal government to help assist the islands, the territories, to not just try to get back into their economic health, but also to get back into, most importantly, their public health. And so one of the conditions is it has to be used for any kind of measures, prevention measures, medical supplies, PPEs, and so forth, to be able to provide that for our community so that the health and safety of our people continue on. It also asks to be used for anything that's unbudgeted as a result of the coronavirus, and those unbudgeted that is not approved or appropriated for the fiscal year 2020 budget. And then any other expenditures that are as a result of coronavirus. So I'm looking at all of these allowable situations to see how we can best use those funds and to stand up our people in terms of helping. And as a bridge, until we start getting the federal programs coming in.
Thank you, Kevin. PDN, Anamita.
Good afternoon, everyone. So, Governor, one of your executive orders placed a moratorium on evictions through the duration of the public health emergency. However, by the time the public health emergency ends, many residents, as you know, will have missed several paychecks and will contend with at least 2 months of backed up rent to pay, along with any other late fees and various other pressing bills. So, what further initiatives do you have to help these residents that are struggling financially, particularly ones that are prone to eviction after this emergency ends?
Sure. So the goal there is to make sure that they remain employed and to make sure that there's some income coming into them. And as we start lifting restrictions, our businesses will start coming back. And these people who are unemployed will probably get their jobs back. And as a way to help them, of course, we have the Pay Protection Paycheck Loan that allows businesses to use their loan to help pay for payroll now, even though the employees are not working, to hire them back so that they continue to be getting income, even though the businesses is not open. So once businesses open, they then can get them back to working. So that's one, I think, which is a really good help. And of course, I am working very, very closely with some key people in the federal government to help us along with our requirements and to approve our implementation plan that we have sent, so we can start sending out the checks for our recovery program. Also, the unemployment benefits, and we have been in close communication with some very key people that would help us along with the details and the application and the process, so we can get that approved, so we can then implement the 39-week program of weekly checks to these individuals. Evictions and moratorium will only be, I think, continued on. That mandate or the measure could only be continued on as long as we have our public health emergency. Just to be very frank, I don't think this public health emergency is going to end real soon. We will have to continue extending our public health emergencies till we actually stabilize our economy. And some people even say till we start getting vaccines and treatments to make sure that our people are not reinfected with the COVID virus.
All right, thank you. And for my follow-up, last week you said that you anticipated the federal money for economic impact payments to come in next week and federal money for the pandemic unemployment assistance to come in by the 3rd week of May. Are those still accurate timelines? And if not, what are the most recent timelines?
So I'm still shooting for those timelines, and I'm actually writing to the president again, and if he doesn't respond to me, I am going to call him, and I am going to make sure that he listens to what we are asking him here, because we are in just as much a dire strait in terms of our people struggling to make ends meet here as any other American in the United States. And hopefully that he would listen and hear us, given the fact that we have extended our help out to the military, that maybe that would also help influence some of that decision. And it's really very simple. We have our implementation plan waiting there at Treasury to be approved. It is a simple implementation plan. We submitted it way before anyone else submitted their implementation plan, and it's now been 3 weeks. And like I said, my frustration is so, I'm very upset about it, and I'm very angry that our people are suffering as a result of this delay. And so I'm pushing everything I can to influence those people that make the approvals to approve our implementation plan. Once that implementation plan happens or is approved, we are sending out the checks right away. We're ready with the checks, we're ready with the process, we're ready with the information. We're just sitting waiting for our implementation plan to be approved and for the money to be then downloaded into our account.
Thank you, Anamita. Next is I-94, Adriana Gutierrez.
Hello, everyone. So, Governor, I know Kevin brought this question forward to you, but I feel like it's still a little unanswered. You received the guidance from the Treasury on the $117 million in the CARES Act. So how does GovGuam, within the framework of the guidance, which you have had since April 26, plan to prioritize the $117 million for financial assistance? Can we get this including, feeding unemployed individuals, small businesses? Can we get specifics on how you plan to prioritize that?
Well, like I said, if I can use the money, I will use the money, but I need to make sure that I use it appropriately and I'm not violating any kind of federal conditions. Otherwise, all of the programs are going to be held back and taken away. So I don't want people to think that I'm holding back this money. I'm not holding back this money. The federal government is not, it's allowing me to use it, but it's only allowing me to use it in very earmarked ways. I cannot use it for lost revenues. I cannot use it to make up revenues that we won't have because of the result of the economy, which is a big source of finance to help our people with their food, to help our people with their, bills, to help our people. What I have done within my legal authority. And what I have done through our local program. So I have increased the public assistance poverty level from 100 to 133%, so more people can be eligible for that program. And I have also looked at advancing, and I advance money for people locally. I advance using our local money to a federal program so that people, at least the 10,000 and below income people, can have their money. So I just want the public to know that I am doing everything I can legally. I am doing everything I can humanly to provide the help to our people. I am not holding any of this money back. Why would I, when it's given to help out our economy, given to help fight the coronavirus? I don't have anything else to say other than I'm doing my best to get it out as fast as I can, given the parameters and conditions that I need to work from.
Okay, thank you. My next question is for Linda. So I know that, it had been previously said that there was gonna be 258 tests done a day, and then with this pilot program on Saturday, there were less than 100 people tested. Is there a reason, and maybe you can just clarify, why there was such a lower number in testing, and then when can we expect 258 tests run daily? In addition, if you could also clarify, is testing free for everyone or not?
Yes, you have multiple questions there. Start with the first. What happened with 52, we can only advertise, and what we did prior to this outreach, our nurses and our surveillance team, which are part of our nurses that are in that team, we also had the other containment team together with the mayor's office staff. We went out to over 147 individual homes, and we assessed all of them. We figured that we will find a lot more mild symptoms. We were surprised to say that a lot of them didn't have mild symptoms. They were fine. There were no symptoms at all. So we branched out further, and the next day we went and we continued the whole outreach. Foot by foot, our nurses and our team went to another over 100 areas, homes, and we found out that there's still also a few. So we moved even further out from the lower Estumbo to the upper Estumbo, and we even went as far as Swamp Road just to see much more information that we can get. And again, these are just people that are coming in. We anticipated actually 100 that we identified that would be our target. We even had enough nasopharyngeal swab to anticipate 50 as an overflow. So we brought about 150 just to be safe. Again, these are the people that are coming in. We did both drive-through. We also did walk-in. We did both. And so the answer to that question is just like what we're seeing at the private clinics. Sometimes they come in certain days they don't. The numbers, it all varies from day to day. And that is part of the reason why we also want to extend it to not only one day, but even keep it at Estumbo. So maybe they'll give them enough time to come out, and we're staying there again on Tuesday and Wednesday, seeing if we can even open it up wider to Wednesday so we can get island wide. And then we figured, okay, if they don't come there, I mean, that's the northern end. Let's look at island wide on Wednesday, and then let's branch off to central and then go to the southern. So again, we're trying to get as many people to come in. And again, we're also having, the added capability with our DLS laboratory, just in case we have an overflow. So the issue is not going to be right now, the fact that I have already communicated another 200 as a backup, plus what we are anticipating 200, that's 400 for each day. We're certain that we can beef up the testing. That's why we're doing this, so that we can encourage more people with mild symptoms to come up. What could also be happening is I asked the same question to my laboratory staff and my doctors, and they also make that remark. Many people with mild symptoms, their body's immunity may be so good that they also are very good in responding and fighting the infection. The PCR testing is designed for acute illness, and when you have a negative test, that's also because your immunity is built up to fight it, and so that could be the reason why they're not symptomatic, they're asymptomatic. And so again, we're journeying through, as you know, we're being very cautious, and that's why we're doing these pocket areas to identify high-risk groups that are not able to come to the clinics, and that is the reason why we want to make certain that we're reaching as many people as we can in different locations. The second question is building up the capacity. Yes, I'm building it up. I've already started with, again, with now we have today the Gene Expert machine test capability. So now we're starting another machine in our lab. And already we have 3 machines that are operational, plus the machine from GMH. We asked also the federal government for 2 more that we are planning to put at not only at GRMC, but the Avid ID now, we could also put 2 more, one at north, one at south, and continue to expand. And again, the creativity that we did throughout this whole process is utilizing federal dollars through the CARES Act that was given to the health center, so that we can buy and purchase all these additional test kits and the nasopharyngeal swabs and the control kits, so that we can expand it on point of care in our facilities, northern, southern, central, and also the hospital. That in mind, as well as GRMC plus DLS, we are beefing it up. So I hope that answers question number 2. Question number 3, what's question number 3?
Is it free?
Oh, for the Medicaid, she asked so many questions all at once, so I'm trying to okay. For those that are under Medicaid MIP and uninsured, Medicaid MIP covers it. So it won't be any cost for any of these Medicaid MIP patients. For the uninsured, we will cover it as public health, because anytime you have any communicable disease outbreak, we waive it, we will take care of it, because we have those grant capabilities to address this. And for those that have insurance, the insurance should be able to cover it. If not, I always encourage people, don't let that be a barrier. Come in, go to our health centers. Public health has also a sliding fee discount program, and we can work things out. So the answer is yes, they're covered.
Thank you, Adriana. Finally, Patty Arroyo.
Could I just add
Of course. Yes, ma'am.
you know, there is also a law that was passed that mandates that health insurance carriers and health insurance programs cover it in their benefits.
K57, Patty Arroyo.
Good afternoon, everyone. Linda, do you have any idea how many people are anticipated to show up for this mass testing all this week?
Yeah, you know, that's the same question I asked mayors, all the mayors, Mayor Savaras, I asked every mayor, because, you know, it's part of planning. We want to make sure we have enough tests and enough nasopharyngeal spots. You know, the only thing we can do, we anticipated 150 overage. We had 150 nasopharyngeal swabs ready to go. 50 showed up. I don't have an idea. I wish I did. I can only do so much as far as encouraging people to come. And that's where, you know, we're planning ahead too, so that if there's a lot more than we anticipate, I have 200 that I'm anticipating for each of these outreaches. I even reached out to DLS, can you give me 200 just in case 400 show in one outreach? So, you know, and she said, not a problem, we can do that. So we're gonna do it, and we're gonna do the best we can, and whatever we have, we're moving forward. So again, that's a question that I don't have an answer for. And we tried doing the outreach to see if we can get to, you know, pass out all the 100. We went through all these homes and we can only pass out a few because they're not with symptoms.
Last question for Admiral Manoni, just to be clear, the field hospital that is just completed and the one that is about to be completed in a few days, that's not going to accommodate the sailors that are currently in quarantine in Tumon. Are you saying that those sailors will be pulled out of these quarantined areas and back to the ship in rotation beginning this week?
So the best way to answer that is anybody who is asymptomatic and negative, those are the ones who went into quarantine in Tumon. If they test positive or show symptoms when they're in Tumon in the hotels, they get pulled back to the base. If those sailors who are positive require medical intervention, they go to Naval Hospital. If Naval Hospital starts to become overwhelmed in their capacity to treat, they would go to the EMED system, which is on the Naval Hospital campus. If then again, the capacity is then exceeded because more of these sailors become symptomatic and require medical intervention, then they would move to the Expeditionary Medical Facility in South Benagayan. But you can see there's a lot of steps that have to happen first before we get to the South Benagayan site. That is more of a preventative backstop to the EMEDs and then to the Naval Hospital for now for TR support. And then, as I said before, this is something that could be used in defense support of civilian authorities if requested.
Thank you, Patty. And now to Governor Leon Guerrero for her closing remarks.
Okay, thank you. On any normal weekend, many of you would have been out with your family and friends. Today, children would be in school and many of you would be at work. But these are not normal times. Instead, for the past few weeks, I have asked all of you to stay home for the health and safety of our island. Let me thank you for all the sacrifices you have made and continue to make in order to keep our island safe. I know many are still afraid for their loved ones, for themselves, and even for what's going to happen once all of this ends. And I know to combat fear, we need hope. And hope is more valuable than it has ever been before. Sometimes all we need is a little sign to keep us going. Whether it be a post shared on social media or lit up on the side of a hotel. Guam Reef has been arranging little messages of hope using the lights of their hotel rooms. Amidst the uncertainty, we need to remember moments of strength that showcase the resilience that we all share in times of crisis. And this resilience is what will help us get through this together. Thank you, Guam Reef, for being a COVID hero and reminding us that we are not alone. I have also been informed that a lot of your questions really don't go to COVID, and I'm thinking maybe you guys are feeling okay, that you're not scared anymore, and that you are more interested about my hair, which I am really very appreciative that you are. So, I dyed my own hair, and a friend cut my hair, and we did use masks, and we provided the I provided the PPE and cut my hair. Not too exciting. And I didn't go to any salon or any other, and it was just my friend and I. Thank you for your interest in my hair.
Well, you look lovely, Governor.
Thank you, Janella.
All right. Well, thank you so much. We'll see you again tomorrow.